From the pros to the local club team, the sports medicine physical therapists at the UNM Sandoval Regional Medical Center work with athletes of all levels, competing to keep them in the game. Joining us now to talk more about the Department of Rehabilitation Services is Doctor of Physical Therapy Tiffany Girardi. Sorry. I kept saying at the beginning, I said, is it Girardi or Girardi? And of course I went with the wrong one. Okay. So Tiffany, let's talk a little bit about and just kind of get a basic definition. Sports medicine, sports rehabilitation, what is it?
Absolutely. So sports medicine is kind of this umbrella term that's used to describe the specialty areas that an athlete receives. So for example, healthcare providers including an orthopedic physician, surgeon, athletic trainer, and an orthopedic physical therapist.
Okay. No, go ahead.
So when I see an athlete, I really address things like the sport-specific drills and movement patterns that are necessary to return to sport, as well as overall performance enhancement.
Okay, so I mean something like that seems pretty specialized. So tell us a little bit about your background and how it kind of works into to the benefit of people coming to see you, for example.
Absolutely. So I received my bachelor's of kinesiology from the University of Colorado, where I also did a 3-year student athletic training program where I worked with athletes from different sports at the university. And then I got my doctorate in physical therapy from the University of Colorado as well. And during my program there, I had a 16-week clinical rotation with mentorship at the Children's Hospital of Colorado, strictly working with athletes of ages ranging from 12 to 25, sports including gymnastics, soccer, volleyball, football, baseball, and wrestling, just to name a few.
Wow, so you've been all over the map.
Absolutely,
really.
That's my passion, is sports.
That's great. So let's talk really quick, Tiffany, about what the process is like for a patient potentially coming in thinking they may need to see someone for surgical rehabilitation, sports medicine. What is that like? What is the process like?
So an initial visit is an hour of evaluation and examination where I really identify weaknesses, functional movement dysfunction, motor control dysfunction, and any asymmetries. And I also am certified in performing a functional movement screen, which is a series of 7 movements, and this kind of helps guide my treatment. Okay.
Now, one thing that, you know, a lot of kids, unfortunately, a lot of people, I know people have had to undergo this as well, athletes who have undergone ACL reconstruction. What is the course of rehabilitation like that?
Yes.
I mean, that can really be a game stopper for a lot of people.
So the first thing I think of, J.J. Watt tore his ACL in the preseason.
Yep.
Bummer. So ACL tear is the most common adolescent injury.
Is it really? Wow.
And following an ACL reconstruction, physical therapy is so crucial. I see these patients for 6 months at minimum.
Really?
So 4 phases. The first phase, early rehab, just the protective phase of the graft, all the way up to the 4th phase, which is ballistics, plyometrics, and actual return to sport. Now, I use a criteria-based protocol, meaning if they don't meet certain criteria, they're not going to progress to the next phase.
Gotcha.
At the end of their rehab, 6 months, I do a 2-hour-long return to sport evidence-based test to ensure that they're truly ready to return to their sport.
That's great. Well, Tiffany, you seem like the person to go to if this is something that we got to be concerned about. Absolutely. What is the best way to set up an initial consultation with you?
So if a patient has a referral from a physician or other certified healthcare provider, they call our SRMC receptionist, schedule an appointment, or to kind of expedite that process, they can just call and make an appointment because doctors of physical therapy are able to be seen direct access, meaning they don't need a referral.
Okay.
However, that comes with the responsibility of paying out of pocket.
Sure.
We do accept a broad range of insurance, health insurance, so if a patient just calls to verify that we accept that, that's how they can do that.
Fantastic. Well, Tiffany, thanks so much for the information.
Thank you.
Guys, again, if you want more information about sports medicine at the Sandoval Regional Medical Center, head over to CASA.com.